All right, welcome back to the Texas Health Education Service Courage Sessions. We're really excited to have you join us today to meet with our guest from the Texas College of Osteopathic Medicine at the University of North Texas Health Science Center, Dr. Mike Kennedy. Before we get to him, we do want to introduce ourselves as well. My name is Enrique Hasso, and I am the Associate Director of the Texas Health Education Service. And joining me on today's Courage Session, as always, is Dr. Deb Beck.
Hi, glad to be here. I'm the advising coordinator for the Health Education Service, and formerly, for about 18 years, I was at the University of North Texas as director of the Health Professions Office there. So glad to be here this afternoon.
And I'm glad to be here as well. Thank you very much for spending the time to have me here today. And for those of you who are listening in, I appreciate your time.
Well, we're really excited to have you since you're the first osteopathic school we are speaking to. Obviously, you are the first osteopathic school in Texas. Now we have two with Sam Houston State joining the fray. But we do have a few questions that we'd like to ask you to help educate some of the students who maybe not fully familiar with what osteopathic medicine is. So would you mind walking us through kind of the philosophy of what an osteopathic medical school is in comparison to an allopathic school?
Okay. Well, actually, there are three osteopathic schools. There's one it's not in TMDSAS. It's part of a COMIS at the University of Incarnate Word. So yes, we as a DO school, though we were first, we're actually celebrating our 50th anniversary this year as a school. So we're pretty excited about that. This year, we've been recognizing a number of pivotal people that have made a difference on our campus, and culminating with hopefully a good celebration this fall. Osteopathic medicine, I think some people, it probably gets a little bit confusing. And to be honest, I've been doing this work for about 20 years at TCOM, and I can always come up with different variations of my own about how to answer it. But to keep it kind of simplified, I mean, let's just kind of break it down to what it is. I mean, the first part of the osteopathic medicine is medicine. I mean, so sometimes people sort of trying to figure out if MD medicine's one thing, osteopathic, the DO has to be an entirely different thing. And there are probably more commonalities than differences. So DOs, when they graduate and finish their residency training, are becoming family medicine doctors or psychiatrists or surgeons or internal medicine physicians or physical medicine rehab physicians. So they're the same thing, or oncologists. They've earned a degree at a different medical school, which is not an osteopathic school. And how does that differ from an allopathic school? Well, a couple of things. One, we have a stronger emphasis on osteopathic, which is osteopathic, obviously dealing with bone structures and the human anatomy. So there's a stronger emphasis on the neuromusculoskeletal system at a DO school. And it's been that way since the inception of the osteopathic profession over 100 years ago, to understand that the human body and its wonderful intricacies is a self-healing and self-regulating mechanism. So DOs are taught about this philosophy, and it's inherent because of that, it's inherent to be more of a holistic healthcare provider, because understanding that the healthier we keep our patients in a more holistic manner, that's the objective. That was a philosophical objective of osteopathic medicine. How different is it to an MD nowadays? Not, in some ways it is, in some ways the emphasis on the musculoskeletal, yes, a DO is going to learn more. But DOs are also been traditionally known about health promotion, disease prevention, but MDs practice that as well. There are MDs on our faculty. Some of the chairs of our departments are MDs, and NDOs. So we're collaboratively speaking, we cross both spectrums in that regard. It's how we're going to teach clinical medicine as our inherent philosophy as a DO. That's an osteopathic physician. So at the end of the day, as we know now in this year, 2020, residency matches were under one roof. So every DO graduate, every MD graduate in this country went through technically one residency match. When I say technically, some specialties have their own match prior to that. But so our students, when they matched, they had the same match day ceremony. So as students at San Antonio or at Houston or at A&M. So same match day ceremonies, going to the same programs. So they're going to be side by side with students that graduate from those schools. So in that regard, there's going to be a lot of commonality. At the end of the day, it's hard to distinguish between the two, but there are some distinctions, and it's usually taught by the school. It's by the school thought that makes those things kind of stand out one way or the other.
Well, thank you for walking us through that. I've answered this question quite a few times in working with students, but hearing the insights now that both DO and MD students are, going through the same residency match program, I think a lot of the confusion might actually melt away with that, because, seeing students from both different types of schools going into the same profession, essentially, or the same match for residency positions. I think that was one of the major concerns for a lot of students who didn't want to pursue osteopathic school. And now seeing that opportunity really opens the door wide open. And I think, from previous visits that I've made to TCOM, particularly during our annual conference that we had there a few years ago, one of the things that we experienced was how the tool set for an osteopathic physician includes a few more things, and an allopathic physician might not. And so I think in practice, there really is additional things that an osteopathic physician have or gain through their experience by going to an osteopathic school. This is actually the first year that osteopathic schools are able to enter the National Residency Match Program. And TCOM actually has a really stellar residency match rate. Can you walk us through what benefit that gives to students at TCOM and other osteopathic schools?
Well, I always give credit to the students. It's the students who do get the work done, that go out and do the interviews, turn in their applications, and really do the heavy lifting on getting into the residencies they're interested in. And for the most part, they do. A lot of our students, they tell us, we ask them how many placing into specialties they're interested in, and the vast majority say they got what they wanted out of they got the career path they think they want to go after residency. So it takes a lot of work to get in, especially some of the competitive programs that are out there that they go into. Second thing, I think we have a good foundational educational curriculum that really has a lot of great tools that prepare students for that next step to residency. And I think the third thing is probably we have a great career development program. We start with students in year one, that we have full-time staff, we have faculty members that serve as mentors in different specialties so they can talk about the specialties with the medical students. We have things to work on, giving them opportunities to enhance their CV, how to construct their CV, kind of looking at how to develop a good strategy to get where you want to go. So those outcomes have really been helpful for many, many years. That I always tell people about that team on campus. They're always there to help students. First thing we always talk to them about, you need to explore what you might be interested in. A lot of students change their mind during medical school. So I think that sometimes gets overlooked. And part of it is when you come into medical school, you may have had one set of experiences or two or three different specialties. And then you find out along the way, here's another specialty, or maybe something you find out this particular kind of doctor does this. And you're like, well, maybe I want to do this. And I've known physicians who are now graduated, they came in knowing, I want to do physical medicine rehab. They're anesthesiologists now. So, they say they wanted to do emergency medicine, and now they're into family medicine because they really wanted to go there because they found out what they really wanted to have in their career paths. And so like family medicine offered to them, they thought the flexibility of what kinds of different things they can do over their life and their career. So that's one of those first steps people want to do, to take that time to explore. Sometimes it's based on what your personal interest is. And I think that's true for any medical student going to any medical school. Sometimes you find out the work lifestyle, the work style, the things gets you excited every day. Maybe a certain specialty is more suited to that than what you might have thought. And then it breaks down to these things about, what kind of things you need to do. I mean, unfortunately, there's competition for some specialties, and actually many specialties are getting more and more competitive these days. But I think if you do the right things, get yourself set up. We want to provide those opportunities for students and get them to understand early, make those steps, talk about that progression with them as they get into second and third year, as they're starting to work on their applications. Our career development team tries to meet with students at least once, if not twice, during this cycle of applying to residency programs to see where they are, their benchmarks. So we were excited. I mean, this year, students did match into 15 different specialties this year for the residency match. And actually sometimes we have more than that. So, but it depends on what they're interested in. And we certainly want to support students that go into these different areas of interest. Kind of a interesting phenomenon for TCOM, and I've been there for a long time. So when I first started, probably the amount of students interested or graduating into primary care was probably about 80%, over 80%. Now it's down in the 60s. So really our split is different now. Our split is a little more associated with probably maybe even close to sometimes the average allopathic program. So a lot of our students are looking at different things and are going into those things. And, our alumni represent over 70 specialties right now. So, and that's just within practice in the state of Texas. So, we want our students to be thinking about these opportunities, going out there and seeking them and representing our school well.
Yeah, I think a key takeaway from that is that opportunities are not limited by going to an osteopathic school. In fact, they might actually be larger.
Yeah. Well, there are still competition out there. There'll be some fields that are still going to be pretty tough. We've noted that over the years. It really does come down to each student and what their interests lie. Are they going to be successful? And I think that's true in any school. There's always been that equation. If going to an MD program is going to be better for me for the hyper-competitive program, well, you have to still be a good student no matter where you're going. Mm-hmm. It's not going to be just a simple, I'm at one school or another, that I'm going to be rewarded with what I want to do. And I think that most residency directors probably are going to be in that boat. Their residencies want the best doctors they can get, graduates of medical school in their program that fit with their program. Because they're going to work with those students for 3, 5, maybe more years. So they need to rely on their work habits, their knowledge of medicine, their ability to work as a team, and through a particularly very challenging experience, which is residency training. So that's a tough thing for everybody.
Yeah. Just as a reminder for those of you watching, and I just saw that Dr. Gwertz is joining us. Hi, Dr. Gwertz. Thank you for watching this Courage session. We are here to answer your questions. Dr. Kennedy will be with us till 2 o'clock to answer any and all of your questions that you have about TCOM, osteopathic medicine, about the admissions process, preparation. So please let us know. We are following comments on both the Texas Health Education Service and the TMDSAS pages on Facebook. Go ahead.
Enrique, we might just mention that Dr. Gwertz is in charge of the Biomedical Sciences Post-Bac Master's Program at the UNT Health Science Center. So we're happy to have you.
Absolutely. And so we kind of thinking about the preparation for students to go into a school like TCOM, would you mind walking us through the early decision program? I know that's not unique to you all, but we're interested in finding out what that looks like for you.
Yeah, early decision is an opportunity. If you feel that you think TCOM is going to be your best fit, where you think you want to be and above all others, then you might want to take advantage of applying for the early decision program. So that means turning in your application early, only turning it into us. That's part of the restrictions of that. And we would turn around and give you a priority consideration for our next class. And it is still competitive in that regard to get into that program, because when we make a student an offer to that seat, we are foregoing anybody else in the rest of the cycle. So, but yeah, if you think osteopathic medicine, you think being in Texas is important to you, you think TCOM will be that fit, then certainly you should take advantage of that. It's not always an all or nothing thing. So if you're not accepted early decision, doesn't mean you're automatically excluded for all the rest of the cycle. Some students move on to the regular cycle and will be placed on the list among all other prospective applicants. So you might get accepted later down the line if you're not immediately accepted. So those are things that could be a benefit to an applicant. It's, again, like, it's not the all or nothing proposition.
Yeah, and more information if you're interested in that pathway and other special programs is available on the TMDSAS website for either medical or dental and veterinary applicants under the before you apply section. You can learn more about special programs, including programs like the early decision program.
And that does have a different deadline, right?
Yes, this year with COVID, we actually, it's still August, but notifications going to be kicked back because we know some students are going to still have some challenges getting some things like letters of recommendation in. But I would really recommend getting everything done by August if you can, getting that information into us so we'll start interviewing those applicants early September and try to get a decision before the end of that month.
So speaking about the application, do students need to have a letter from Adio?
Absolutely not. So I know this has been going on for a long time, and sadly, I'll meet applicants on interview day, and I'll ask them. They mentioned to me they didn't apply the year before, and they're applying to us this year. And I ask them why, and many of them will tell me, "Well, I didn't have a letter from Adio, so I didn't think I was going to get in." And I'm like, "Well, you're here on interview day now, and I would have told you would have probably been here a year ago on interview day if you had turned your application in. So don't worry about that. I mean." We take letters from MDs. It's great to have a physician letter. I mean, it'd be wonderful to have a DO letter. Don't worry about that part. It's really about how you think you might fit in, that you think you might want to be a part of the osteopathic profession. And it doesn't mean you have to forsake the MD profession to say that. And that's another thing I tell applicants, don't worry. You don't want to go in a situation of saying, I want to be a DO because MDs are bad people. And we don't want that. I mean, we don't see it that way. Again, many of the people on the committee, there are a number of MDs on the committee, and they read that essay and they're like, wait a minute. We don't want any of that classification going that way. We want to be collegial. It's a choice that you want to make as a student. And it's ultimately, if you have a choice between the two, that's your decision to make as a student. Very competitive candidates will have choices and some, to get into one school or the other. And it's their choice at that moment, what path they see themselves in their future, what they want to do. And myself and probably every other admissions dean in Texas feels the same way when it comes to that. We want to certainly hope that you would, if we make you an offer, we hope you accept it and come. I think that's probably true to as well, but we know we're not everybody that we offer a seat to will come. But I don't want them to be discouraged because they think, no, I didn't shadow a DO. I didn't get a letter from DO. I'm not going to get in. It just doesn't make any sense. I mean, it just diminishes your opportunities to get into medical school if you go that route. There are a lot of, there's probably at least 1,600, 1,700 seats right now among all the TMDSAS schools. Not applying to TCOM is taking 230 of those seats off the table. It's 230 less opportunities you're going to have to get into a Texas school. Then you're kind of stuck in a situation you might end up going out of state and paying maybe a lot more money. Those are strategically as an applicant, those are things you might want to think about when you're putting in your application, going, every time I don't check a box is one less opportunity I'm putting in for somebody to take me for their school. And sometimes it matters to go to an interview at a school and see for yourself, is this a good fit for me? Sometimes it won't be a good fit for you. Somebody else will be a better fit for you. You might find TCOM's the better fit for you all along. And when you go there, that's absolutely, people come in interview day. Unfortunately, it's virtual this year, so we can always talk about that. It's going to be a little bit more of a challenge. We hope someday students that will be admitted will have more opportunities to come when hopefully things get better. We don't know, nobody knows when that will be. So we're all cautiously optimistic about that.
Yeah, and I think you bring up a great point there that, TMDSAS is a flat rate fee, whether you apply to one school or, I believe right now it's 18 schools of dental, medical, and veterinary schools. So it's a flat rate. You're not losing really anything except, going through the application, and it's the exact same application. You're just releasing it to TCOM. There's a secondary application. Could you walk us through that? Maybe I know a lot of students have had questions about, with MCATs delayed this year in particular, that some of the schools may not reach out and for a secondary application until the MCAT scores are received. Is that the case at TCOM?
No, our secondary actually is open right now. Anybody can go in and work on it right now. We don't wait for MCAT scores. We don't wait for your TMDSAS. So there are people actually now going in and filling it out. The only thing you do need to have your TMDSAS PIN number, because that's how we know your secondary is getting matched to the correct TMDSAS application. So you do need to have at least that data point. Make sure you fill in your demographic information correctly so that it matches person to person. So we don't want to match you to the wrong application. But every applicant is entitled to turn in a secondary. We do not charge for our secondary application, so it is free. So it is free and it's online. Everybody can fill one out. So again, just go ahead and take a look at it, see what you think, look at the questions, take some time, think about how you want to formulate your responses and and fill it out and turn it in. I mean, again, interestingly, a number of people don't fill that out. Again, it's free. It takes maybe, a couple hours of good thought and typing. And really it's just more the thought than the typing. The typing doesn't really take that much. There's only about 2 really solid essay type material questions. Many of them are more informational questions that we'd like to know about. Sort of like things if you turned in your application early to TMDSAS, and since that time you had summer grades, we'd like to know that, or those kind of just small bits of information. So again, it's relatively simple. We like to keep it as minimal as possible to not be intrusive or really be an obstacle for applicants to get their stuff into our school. So you can fill it out now. Usually when people email me, I tell them, they say they're studying for the MCAT. Should I start working on it now? I said, no, study for the MCAT, take the MCAT. If you're taking it in June, then pivot to your application afterwards. Because you want to distract yourself, and you've got time. You still have time this summer. Again, schools are starting. I mean, we are getting applications in. We haven't even started really inviting anybody in for an interview. So you've got plenty of time. If you're taking the test this summer, just work on it bits and pieces. Once you're done with your MCAT, start putting some diligence into your other work. I always recommend, this time of year, especially with COVID, try to reach out to your letter writers sooner, give them more time. Many of them are working remote, so it's going to maybe a little more of a challenge for them to work on and write your letters, get those letter packets in, or get an individual letter in. So we get extended that deadline. We want you to use that time wisely, not just wait another month to ask people to get things done. Use that time to give somebody else another month to fill out that information.
And as far as TMDSAS goes, you can't submit your application without letters or MCAT scores. You indicate who your evaluators will be in the application, so TMDSAS will keep an eye out for when those are received. And when you provide planned MCAT test dates, the schools will know when to expect your scores. And you can submit your application with that. And some of the schools will actually start the review process. Even without that. Obviously, they won't extend interview invites for the most part. Is that true for TCOM?
Yeah, we wait until the scores arrive. But yes, it's better to get your application submitted, get it to the schools now, and just tell us when you're taking the test. Yeah. It's a lot easier to get an update than it is to wait for the full application to download and have our team process it. It's already processed. All it is an update. And as you know, TMDSAS updates us every day. So you turn in the score one day, it usually is 24, 48 hours later, it's in our office. So, and we know it's there. Our team gets it on a list of applications that are completed for review.
All right, well, we've got some questions that all seem to be about the interview. So we're gonna move on to that topic.
Okay.
So the first question is, I'm not sure, this is from Catherine Renee. I'm not sure if this happens at TCOM, but it may be worth mentioning that while interviewing at DO schools, you never know who your interviewer is. I was interviewed by a DO program by an MD physician, and I'm so glad that I spoke highly of MDs during our conversation. So that goes back to not disparaging MDs in a DO school. They're not quite a question there, but I appreciate that feedback.
And there are times you'll be interviewing in an MD school and an DO is interviewing you. So I know quite a few alumni over the years have told me, yeah, I'm an interviewer for admissions at another medical school in Texas. And people don't even realize what they're, until they look down at their badge and notice, oh, it's a DO that they're interviewing with. So yeah, you just don't know.
Right. We have another question here from Jessica Parapuram. Since there is a switch to video interviews, will TCOM be using MMIs? And actually, you all have been doing MMIs in person.
Yeah, for 3 years, we've been doing the multi-mini interview. We are planning to do the multi-mini interview again through a virtual format. We're in the testing phases right now. We're looking at different ways to do it. So we are starting interviews in September. If something changes in this regard, we'll let you know, but we're committing to doing virtual interviews this year. Safety is our top priority for the applicant, for the campus community. We're trying to minimize the number of people on campus in a given day. So even with our current students that are going to be enrolled, so with COVID, it presents all sorts of challenges. Some days there'll be hundreds of students on campus, and we'd like to minimize the number of any other staff. They don't need to be there. They can work remotely. If we can do interviews remotely, we'll do that. Actually, what's going on around the country is many residency programs have converted to virtual interviewing. So they've started to do that for residency programs, which for many fourth-year medical students, that's actually going to be great. If you know a fourth-year medical student, you know that it is an extremely challenging task to interview for residency programs as a fourth year, because you may be flying all over the country, spending tens of thousands of dollars on your interviews, dressing up in a suit, missing a lot of clinic time to make up just to get those opportunities to get placed into a residency. So having that opportunity for virtual is going to cut down a lot of those challenges. So we'd love to have the students on campus. I mean, and we're going to miss you guys, having you here on our campus a lot. It's one of our favorite days to get to meet somebody, get to know them. And there's a lot of great rapport that happens between interviewees. They get to meet each other. They get to have a lot more intimacy and time with their students. We're trying to construct ways we can do that. But we also at the same time want to be aware that staring into a screen for hours on end is going to be very taxing. So so we're going to try to minimize the amount of time that someone has to do that, but also be able to interview them and also give them at least a sense of who we are by the end of the day, and give out maybe more opportunities to come back later in a more relaxed state. So, because I can imagine it'll be challenging to dress up and sit there for 4 or 5 hours. So we're trying to keep that condensed as much as we can. We've been working on it, started last month. We're continuing to work on it to finalize it, but we're hoping to still provide a good experience, but one that's at least as minimal stressful as possible.
Well, considering the horror stories I've heard of students getting blisters from walking around campus during interview day in their nice shoes, I think sitting in your outfit at home, in your interview outfit, I think that's a very minor concession.
Oh yeah, the new shoes. Yes. We had a student on a tour once, and she had been wearing these new shoes all day. The blisters were so bad. By the time we got to an ICU, the staff, the ICU gave her the booties they give patients to walk around on the floor. Said, here, you can have these. You don't have to strain like that anymore. And she gladly took them on the rest of the tour. And we were like, that's fine, please. Please put them on. I don't want you to be in pain as you're walking around. I'd rather see that on. I don't judge you that way. I understand that new shoes can do that to people. So we were just fine with it. And said, we're not going to evaluate you on what happened with your feet. So we're more interested in other things going on.
So Dr. Beck, from your perspective as an advisor For students who are interested in applying to DO schools as opposed to MD schools, are they advised differently?
Oh, not really. You still need to have your shadowing, and with any kind of doctor, as Dr. Kennedy has stated, because you will get a very similar experience with whether it's with an MD or a DO. You still need to do volunteer work to show your altruistic tendencies. You still need the MCAT. You still need the good grades, the high grades. It's very competitive for both types of med schools. So they, of course, with the 3 schools in Texas, if they want to broaden that, they would need to go outside of the state of Texas to apply through a COMAS. Dr.
Right.
Kennedy, do you want to add to that?
Well, I know that, yeah, I mean, service, medicine's a profession of service. So
Sure.
we really want to see people that want to do it, not because it's got to be on their application, because they just want to do it. It's something that we want to see as a long-standing interest. Be that person that's going to give to help others. Our students do a lot of community service, and their time is precious, but they do a lot of it. They're out in the refugee community. They're out working with the homeless. They're out working in underserved neighborhoods. They do it because they want to. They want to contribute. They want to be in. It's the human side of medicine. They want us. They don't want to just sit and read about pathophysiology and physiology all day. They have to do it. Everybody's got to do it. They be a good doctor, but they got to get out. They want to get out and be with the people as much as they can. And we really enjoy having students that want to do those things. Many students have started their own initiatives in school, being very entrepreneurial, saying, we don't have this, let's do this, let's be involved in this area. I think that's an important part of your application, as having, because, well, it's an important part if you really want to go into medicine. I think that's probably even better to say, because medicine has its financial rewards, but it's a taxing process. I mean, for anybody to do. You could probably make a lot of money going doing something else, but the hours you'll put in and the commitment, educational commitment, the debt you'll go into, you could probably do something else and still have some of those same rewards, but you got to follow it because it's your passion. Another thing people have been asking about is shadowing this year, especially with COVID. Pretty much everybody's shadowing opportunities just fizzled out around March, and it's no time soon it's coming back. Actually, for many medical schools around the country, it's been a challenge to go back into clinics because we don't want to expose our students to COVID-19. Hospitals don't want to expose, or clinics don't want to expose medical students to this and get them sick. So there's been a lot of keeping people, minimizing the amount of time medical students. So I can imagine it's going to be even worse for prospective students. So my 2 cents on that topic are, unfortunately, at some point you have to have had some kind of experience, or at least show us, even if it's not shadowing, some kind of experience and exposure that explains to us in your application that I know what medicine is and I know I want to do it. So, and the only way to do that is really have some exposure to the profession of medicine. It has to be somewhere expressed, or it has to be to the point where at least we feel comfortable to know this is the person going into this, and this person's going for the right reasons, but they know what they're getting into. So it's going to be a challenge if you've not shadowed up until March, or don't have an exposure to explain that. I don't have a minimum number of hours you have to shadow somebody or shadow a physician. I mean, we've had some that have done very little, but there are many other characteristics we felt like this was the kind of student we wanted here, because their passion to serve, their what they made of their time was valuable to us. It was insightful. It was interesting. And then sometimes there are people that list hundreds of hours of shadowing, and they go into there and they don't bring us those insights. They don't bring us that passion. So we're like, well, we'd rather see the passion and the insightfulness that comes out in an interview or comes out in our essay about this is what I learned in the time I spent with this physician, or this is the things I saw, the observation of what they're seeing in those clinical settings. So some people, it can be 20 hours, some people it can be 100 and 500 hours of time, and they still have they're at the same place. And we're like, well, okay, these are things that we want to look at. Is it going to make a difference? It's hard to say. We don't assign to say, if you have this many hours of shadowing, you're going to move this high on the list versus someone that doesn't. But again, if you've already got some experience and you feel like you can express that experience really well and explain to us what you learned from it, again, turn in that application this year. A lot of schools are going to realize that we're not going to see a lot of activity from March to after March. It's just the reality that we're all going to be in. We're not there to penalize you for it. But that's about the most I can go with on that topic.
Dr. Kennedy, you do a fantastic job of anticipating the questions that are coming in.
Oh, okay.
Because we just had a couple of questions that were asked. One is, do I need shadowing hours if I work as a full-time nurse practitioner? Just to echo your statement.
Oh, full-time experience? No. I mean, you certainly, again, you're under the same criteria. So, I mean, we've had people who have been nurses and some have been PAs over the years, have gone to medical school. It's the same criteria about why you might be interested in moving on to a different profession and why you see this as a good match for you. It's okay. I mean, we've had professionals, healthcare professionals move on that want to go to medical school and train, and they turn out to be pretty good medical students. A number of them. It's a different set of challenges from other health professions because medicine is much more scientifically driven. So many of those students have ever come to me. They've said the science was so much deeper in medical school than I expected, to what I learned previously in other fields. I did know some things, but I didn't realize how much I was going to have to learn when I got here in a medical school setting. So, but in the clinical side, they tend to be pretty strong students, and they already they know about the healthcare team. Being a part of the team is an important thing. So even actually the head of our clinical practice on campus, he used to be a flight nurse before he became with the medical school. So he knows, he's someone that's been in that boat. Now he went to emergency medicine as his career path, but now he's running our clinical practice. But yeah, before that, he worked on a flight nurse on a flight medical team.
Awesome. So we have a couple of questions that came up as follow-ups to the interview. So we don't mind going back to that topic.
Sure.
With the interviews moving online, is there a chance to visit the campus in a smaller group or virtually?
Yeah, we're looking at somehow way of presenting our campus virtually in a tourist type setting. And we're engaging some people on campus. Our students are interested in doing it. Actually, they would love to show off TCOM's campus somehow virtually. So they're even jumping in and providing ideas. And, so it'll probably have to be that for at least a foreseeable future. We don't allow visitors on campus, even just to come one-on-one, even if they were just by themselves and said, I would like to look around. We don't want any visitors right now. And it's just a safety thing for the entire campus. If restrictions are lifted and things get better, and those are big ifs for some time, we want to be cautious with that. My hope is that an opportunity will present itself, hopefully by spring, that students can come to campus, and especially if they're been admitted, they're on our wait list, have an opportunity to come visit, maybe have some precautions in place still, but even maybe smaller groups to be able to show them their campus, because I think for them, they would like to have some of those abilities, especially when they're trying to make a decision about attending a medical school, to have some time to actually set foot on that campus, which is, again, going to be one of those challenges every school around the country is going to have to face and try to figure out. We want to be transparent about this. And I think everybody wants to be transparent, want the students to see this thing, be informed in their decision. So we're hopeful. And I don't want to commit to anything right now. Again, we want to be, safety is going to be our top priority for our students, for our prospective students, and faculty, staff, and the best way to do that is social distancing right now.
Thank you. In terms of the interviews, how much time is allotted for the interviews?
Well, actual MMI questions we've been allotting. It depends. This MMIs differ a little bit by school. How much time that they could be. We typically, a question itself, or what we call a station, is 6 minutes in duration, which is actually the way an MMI works, is that you're given given something called a prompt. Prompt is some sort of statement or question that you get and you have about 2 minutes to sort of digest the question and formulate your response. And you do that actually outside the interview room. So you do that. One of our proctors calls, says, "Tom, you may begin." That's when you open the door and you go in. Well, this will be virtual though. You go in and you sit down across from your interviewer and you answer the question. So at some schools, actually, that's all you do is answer the question. When you're done, and there's nothing else that happens in that interaction. Other schools, like we do, we actually allow our interviewers to ask follow-ups. And so that becomes a little bit based on your answer. They may have more questions. So that, the topics typically, questions and prompts tend to be around certain domains. It could be teamwork, or it could be resilience, or it could be motivation for medicine, or it could, how to handle difficult situations. So those kind of things could happen. Other MMI things could be task-oriented. So task-oriented ones could be you are asked to go do something in the room with maybe someone in the room that's sort of giving you a situation, a challenge. Those are potentially possible too in some MMI scenarios. Interesting, University Incarnate Word, I did not know this until recently. They actually have what they call a writing station. So they actually had a situation where the prompt was go in the room and write an answer to this question. Then you sit there for your time and you would physically write out the answer, which I think was very fascinating. There are, trying to think of anything else. Kind of question. Yeah, usually sometimes role play, sometimes a discussion, sometimes a task oriented thing. The idea is, the objective of an MMI is that you're allowing multiple people to evaluate you, and hopefully more people evaluate it, more likely we're going to develop at least some kind of understanding of strengths and weaknesses, mitigate biases. So if somebody may be biased in one way or another, we have other people that will kind of counterbalance that, or at least tell us like what some sort of consensus of where this applicant lies in terms of their ability to handle these questions. Sometimes an interviewee, this is not uncommon in a one-on-one setting. You come in your first question and you totally bomb the question. And you wonder if you can recover for the next 30 minutes. Well, in MMI, you bomb the question, you're done with that one, but you've got other opportunities to do well. So you have chances because the other people don't know what that first person happened in that room. So it's up to the committee to decide how, the circumstances and how the overall performance is. But that's something that's kind of unique about MMI interviews that we kind of like, that we can get different opinions. This has also added more opportunities to bring in non-traditional interviewers. So we've had people from staff who work with our students on a frequent basis. I've asked them to come and interview so that they could they have a vested stake. They work with our students probably much more so in some ways than some of our faculty. And I'm like, well, what kind of things do you see are good habits and not good habits? Maybe you can help us discern students that you might see as a good fit for us. We have students come in and interview now. So we've opened, our dean has offered the opportunity for students to come and participate on interview day, so that they're staking, so they don't have a stake of saying 30 minutes with me as a student, makes or breaks your situation. So at least having some opportunity to come in, visit with, and so students actually now on the admissions committee, they're voting members of the committee. So we've added that element to this whole, as sort of opening up this process for greater participation outside of the school. So getting back to the whole MMI thing, MMIs are unique in that regard. A lot of schools are moving that way. I think a lot of schools are looking to try to do things maybe not necessarily unconventional, like Casper, for example. Casper is sort of an online version of the MMI. I don't know if that's the proper characterization of that, but many of the people that worked on MMI also worked on Casper. So it describes itself very much domain-driven, multi-segmented sort of competency or domains that you're being assessed on. So an MMI is sort of a live version of that. At least my understanding of the two. So that's kind of what I would suggest to describe that process for you.
Yeah, and it sounds like a lot of these domains that you're discussing actually kind of overlap with the core competencies that were described.
Yeah, we try to look for questions that somehow will look for competencies that we're really interested in. Things that again, what I really enjoy about the questions, actually, we do use a Q bank of questions that have been tested before we've implemented them. So, and interestingly, a number of the medical schools around the country use the same Q bank. So I found it ironic last year because some of our applicants said, I saw this question before. I wanted you to know that. And I'm like, that's okay. You know, there's been a lot of studies on this, so it doesn't necessarily, if you've seen it before, you'll actually do any better or worse on it. There have been some analysis done on that. So we've looked at, there are people who've come back and interviewed multiple times. So, and through an MMI, and they may have seen the same question before, but you know, we've not seen any dramatically different results of that. Of those performances. So how the students do in the interviews. But yeah, so it's interesting. The Q bank, Unit Incarnate Word uses the same Q bank as we do. I've seen some other medical schools around the country when they do sort of their presentation, I'm going, I know that question. So, you know, MMI is actually imported from Canada. So a couple of Canadian schools are very unique about it. They actually, one school had posted their questions for the year on their website. So here you go. Here are the questions. So, and just to give you a heads up, but they don't tell you what the follow-ups could be. So that's where it gets a little tricky. So some people think by going in and trying to memorize the question is a you know, strategy, because, well, it's not, because there could be 4 or 5 ways to go on an answer. When we pick a question, we actually kind of do that exercise. Which way can you go with this? And they're very unique ways, and they're not necessarily right or wrong. And so when you pick a direction, it could follow up this direction, or it can follow in that direction. So it takes some depth of thinking to get through this. So just coming in and regurgitating some answer would not really be very helpful. Actually, in some ways, it's harmful for an applicant. And we've seen that applicants come in and just feel like they're hyper prepared for that question. And then answer it, they don't know where to go with it from there. They didn't understand what they were even answering. So then the interviewer starting to, you know, sometimes when I do these interviews, I sort of catch on to a sentence or two of the response. And I'm like, well, tell me more about, you said this, tell me more about that. And explain to me a time where that might have happened, or those kind of things. And then you're sitting there, if you haven't really thought this through, you're like, and then it gets difficult for you. And then it gets very, you know, then they're uncomfortable. My goal is not to try to make it uncomfortable, but I need to challenge you. I need to know more. It's about the learning the depth of your knowledge of a particular domain or a competency or anything like that.
Yeah. You know, Dr. Beck, if I could bring you back in terms of advising students, you know, we just talked about sending out your application to all the schools because it's a flat rate fee. Mm-hmm. And now we're saying, you know, the interview process is a little bit different between schools that do the traditional interviews and other schools who may do MMIs. Mm-hmm. How do you prepare for both?
Oh, well, by all means, go talk to your advisor, and they may even have some mock interviews that you could practice. It's always good to practice. And if your advising office, maybe they don't offer that service, maybe a professor would be happy to ask you questions or set up some scenarios. We did both types of practice interviews in our office and at the University of North Texas. And I know that people offer those services. So by all means, or maybe your club, that would be a good project for Alpha Epsilon Delta or SNMA. And you could have a whole day of multiple mini interviews, or half a day of multiple minis and half a day of traditional interview practicing, and enlist the help of your professors and your advising office. That'd be a great project to organize.
There are some prompts out there, questions online. I don't share the ones we use because we've had an agreement not to share those questions. Like it's like someone asked me, do you have some sample questions? I usually just go online and if they're public domain, then they're out there. I can't share the questions we use because they do belong to, they're intellectual property of someone who took the time to write them, test them, evaluate them, and come up with results. But there are questions out there that if you hit a search engine, you probably will find some questions. Some are very unusual. I've never seen anybody use them, but some are pretty straightforward. I remember there's one on video on a YouTube about somebody, it's more of an ethical dilemma. You were the question was, pretend you are a tenant in an apartment building, and a friend wants to stay with you who's not, and it's against the rules. Do you let them do it or not? And then the next thing you say yes, and then next thing they want access to your facilities, like workout facilities, which is totally against the rules. So what line do you draw? How do you do that? And sometimes it could be a twist. It could be you go tell the friend right now. That could be your scenario. Walk in and tell your friend they can't do that. Or it could be discuss how would you handle that with your friend? Or do you? I mean, some people might walk in and say, sure, I'll let him have the key. What's the harm? Or somebody might walk in and say, no, I don't want to give them the key. And how are they going to get out of this? And try to keep their relationship positive with somebody, but also draw that line. Understand that dilemma. What is the dilemma there? And those kind of, even it's a simple dilemma about someone living in an apartment complex, what does that mean in healthcare? Mm-hmm. About when you're going to be asked. I mean, most people at some point might be asked in their healthcare career, or even as a student, hey, sign in for me on this class. I'm not here. Just put my name down that I was here. Hey, we need to go do this. Just sign in and leave. Come with me. I need you to do this. Or you're being asked to do something you intuitively know it's not the right thing to do. How are you going to handle that? So that's what usually the questions themselves have a front face that doesn't make sense to medicine, but there's a behavioral part of that we're trying to figure out. How would you handle that?
And I think it's also important to say what you think and not what you think the interviewer wants to hear.
Oh, absolutely. I think that's very important to be genuine, because again, you might fallen into the trap. If you don't really support your own position, you're going to find out that interviewer is just going to keep going at you in different directions and trying to figure out who you are and how are you going to handle these things. And you know, that professionalism is important, but there's going to be that line about, well, do you be compassionate? Or, if you help someone out, are you being compassionate? If you don't help them out, are you being uncompassionate? If you don't help somebody out, you're being ethical. Or so that there's two dilemmas right there that you may get stuck with one simple question. And you have to kind of weigh those options as an interviewee or the interviewer in that conversation. How do you handle that?
I have a couple of questions here related to dual degree programs as well. But before we get to those, I did want to ask the question of how TCOM is addressing health disparities in Texas. I know there are several initiatives, particularly related to rural health.
Yeah, we're pretty active in rural medicine on our campus. I think it's traditionally been there for many, many years, probably 25 years or so. A lot of our graduates have gone to small towns throughout historically in the state of Texas. I think hopefully there'll be more ways we can address health disparities. UNT Health Science Center is home to a really good research center on health disparities within our graduate school. And they host an annual conference, which has some very fascinating topics to address in that area of health disparities. Having being in a community that has many needs for our students to have exposure to and understand the consequences of why health disparities are an issue, workforce issues, or why, where those gaps are in healthcare, where people are left behind. And I think we've seen that more than ever now. It's getting a lot of interest and in a very sad but true way. That's a good thing that people are starting to see this and starting to understand where this is. So I'm hopeful that things will start to look differently on our campus in terms of what we want to do more. I mean, what we have done, what we want to continue to do, but what else we can be involved in on our campus. So, we've always had some traditional programs that have done some good things and continue to do good things, but we want to I think there's some outreach to be done. I think there's going to be, and I think a lot of healthcare teams around the country in terms of medical education or health professions education are really going to have to look much more closely at this topic.
And you also have the primary care pathway program, I believe, with Midland Hospital.
Yeah, putting doctors in, thank you, Deb. I mean, Dr. Beck had been involved in this and development of this program. We started with a community in West Texas who is Midland-Odessa area. Very strong, high shortage of doctors. We're going to start we've been doing some pipeline programming, and even putting 2 or 3 more doctors or 4 or 5 more doctors a year into that community is going to make a difference. And bringing in, physicians that we think are going to be who will have a passion to serve those communities, even those who need it most. And those are big impacts. I mean, one doctor can make a difference in an entire community very quickly. And so the more doctors we could do, just even if it's 1 or 2 here or there, it can make a huge difference. Right now, many doctors in these communities are struggling that are out there now. They need help. I mean, and you hear these stories about they don't have time to themselves. They start to burn out because they're the only doctor for miles, and they can't turn away their patients, but at the same time, they can't help themselves, which is a big challenge for them. So
that's fantastic. Thank you for sharing that. And, I know that Ann Smith is one of the folks that we work with closely through the Health Education Service to get the word out on some of these initiatives as well. So shout out to Ann.
Yeah.
So the question back to the dual degree program, somebody's asking specifically, could you speak to the master's program at the UNT Health Science Center and how it relates or isn't related to TCOM?
That must be the biomedical sciences.
Yeah, it must be the
Master's
in Biomedical Sciences program. And actually, it's a great program. It's been around for about 20 years now. I mean, I think the first cohort was about 2001. I just started there. So when the first cohort came through, and I will say, and right now, I don't have official numbers. I know Dr. Wirtz is out there, so I apologize if I don't have the official numbers. But I mentioned the other day to the current class of students, I would at least say there's probably well over 500 graduates of that program that have attended TCOM and are currently there or have graduated. So it's that opportunity to, if your academics need work and you need to show a medical school, I have the ability, for whatever reason you haven't shown it yet, you have this 1-year opportunity to come into a very good graduate school, get a rigorous curriculum that's related to medical science, perform well, and demonstrate to medical schools or dental schools or any professional programs that you are capable of doing the work. This is a fantastic program. It's grown a lot. First cohort was about 7 students. Now it's up to probably almost 200 students a year into this program. We've had a lot of wonderful students, and their career outcomes are very interesting. I mean, people have done that program, if you're thinking in your mind that your undergraduate work or your MCATs are going to worry about your residency opportunities, it's not. Students have gone to that program, gone to like nationally competitive residency programs out of TCOM, because they come in, they know what they're doing in medical school. And the value of that program is not just the content. I always tell people the value is also having a year at a health science center environment. It's a different kind of place. We only offer a graduate program, so everybody's earning a master's, PhD, or DO degree, or even an MD school on our campus. So you have those opportunities to be in that environment. You have a year of just graduate education is different. It's more focused. It's more disciplined in terms of the kind of rigor and content. You have a year to grow. So the outcomes of that is just not even an academic outcome. But I always tell students in this program, I said, the first day of class for these students is very different for that group versus everybody else. So first day at TCOM, when they come to TCOM, first day at TCOM, you'll have, everybody comes in, they have their brand new tech packages, they're opening up, they're all kind of looking around at each other going, what's going to happen next? We know this first day of school, what's going on? They see the faculty milling around. There'll be a group of about 40 or so students. They're ready to go. They know who the professors are. They know the class material. They know what the expectation is to perform. And everybody else is just sort of feeling their way around. They always catch up. I mean, everybody kind of catches up and figures it out, but it's just a fascinating experience to watch visually. Won't get to see it this year, but visually kind of watch that moment where I walk in and I tell everybody, don't worry, everybody, everything will be fun for everybody. It's like, you can do this. I know you can. But it's interesting that there's a group of students who, for whatever reason beforehand, were seen as not being able to do that. But now they can prove they've done it, and now they can show again they can prove it in medical school. So it's a fantastic opportunity. I mean, there are other programs around the country, and we've taken students from UNT is obviously the biggest feeder for us in terms of graduates that come into our program. This year, we'll probably have about 40 or so. It's not final, our class is not finally set, but at least about 40 at least. We'll be out of our 230 students coming out of that program.
Wow, that's fantastic. Just to round out the discussion on graduate programs and bringing it to the topic of once students are matriculated for dual degree programs, could you walk us through some of the dual degree programs that TCOM offers?
Right now, we have a dual MPH for their school public health. You can complete it. It's a little bit of a challenge, but you can get it done in 4 years. Because some of the work that you're doing at TCOM translates into credit in the school public health. So it sort of comparatively puts it together. It can be done online. So it gives you that, if you kind of discipline yourself and take one course term, maybe even start early before med school. Some students have done that, and over the years have started maybe the summer before, take a couple of courses just to get sort of their less stress through those 4 years, or finish it after their graduation if they're just a couple of courses short, it's an option available too. DO PhD is the crown jewel. So it takes 6 to 7 years because you'll be doing research, intensive research in a graduate school. So you spend 2 years in medical school, 2 to 3 years in graduate school, and then your last 2 years of medical school. Something is a little different about our program. You don't have to declare for the DO PhD before you start medical school. So you can be a year one student, feeling very successful in medical school, feeling like I can take this extra challenge, and I'm really passionate about a research program that's on campus, and I really want to have an extra involvement. I see myself doing academic medicine as a career path. Then this might be for you. One of the things we also do, Dr. Michael Smith runs the program, something that they've done really well was there's clinical time during your research years. So even it's just a little bit. So students don't lose those clinical skills from the first 2 years they've learned. So they actually go to a clinic and actually do some of their skill sets. So they do the patient care maybe one day every couple of weeks. So interestingly, so when you're finished with your research, you also finish part of your med school rotations. Wow. At the same time. So you actually can get back on track fairly quickly. So what was really kind of fun, for many years, I got to call names at graduation. And the last one that gets called is the DO PhD. So if somebody's graduating from that program, and I tell you, there are 6,000 people, and waiting in the auditorium, I take extra time with that one. It's the one name I'll wait very long to give a nice long pause, because from the last DO graduate to DO PhD guy, because I want people to realize this is somebody who spent a lot of time. Their classmates have graduated and gone on, but they've made this commitment to stay here and do this because they see a future with this kind of career. It's a great program. So it's a lot of students that do it. Some come out with multiple publications under their belt. They do some really exciting things in the specialty fields they're interested in. So another program that it's in the works. It's going to hopefully roll out soon. We're looking at doing a DO Master of Health Administration, so a dual DO MHA. So stay tuned for that. It's probably going to be a 5-year track because the MHA is much more focused to healthcare. Obviously administration. So we're working on those details now, how to incorporate that for our students. But that's something we're hoping to add to our plate of dual degree options for students.
The options just keep growing.
Yeah.
Fantastic. Well, we are a little past our hour that we had allocated, but before we cut the live feed, I did want to offer you an opportunity to share some courage for our students. This is a bizarre year with all of the impacts caused by COVID-19, both those that we know of and those that we might not even be able to anticipate yet. Do you have any words of wisdom for applicants, current applicants, or even future applicants?
Oh, well, don't let COVID discourage you. Okay. Many people, even on the medical school side, there are things we just don't know. So on the admission side, what this is going to look like this year, how this is going to impact student applicants and their opportunities, or how we're going to assess them. So we're all in the same boat in that regard. So don't let that discourage you, that you're thinking that somehow your application's at advantage or disadvantage this year based on COVID, or if you're worried about that, how that's going to impact. Do some homework on each school, see what you like. I mean, I think in general, when you're looking at your paths, medicine's a great career path, but also keep an eye on all the opportunities that come up. So you just never know. It's like I said about specialties, it's the same thing about careers in general. So you can be looking down one path so much. Many people kind of look at, for many years, and I think for those of us who have been the older group, so I'll just say that they've been around a long time. Growing up, we always felt like there was two professions, doctors and nurses, and there was nothing else to do. There's just so many other things now. I mean, there's so many things that people can do, and those careers have taken off in so many different ways for people to look at. So if you have a passion to serve, I mean, look at medicine, look at all sorts of things. Don't just give up just quite yet on that. Don't be discouraged about COVID. We're trying to work our way through this. Thank you. I appreciate the time that people are spending to come and listen to me talk for this hour. I hope it was helpful and informative. So in terms of that regard, so Texas is a great place to go to school. So I think you can't go wrong to go to Texas Health Science Center for your education. It's just truly amazing. As Dr. Beck and Enrique, I know we've been to a lot of these health science centers. We see what the opportunities are available. It's just amazing. And you won't find the opportunities especially at the tuition rates. You won't find these opportunities just everywhere. Texas needs healthcare workers. So, we need you to stay here. We need healthcare workers and everything. So, go forward, keep moving forward and seeing where you might lie in your future. It's a long way to go.
It is, and it's worth it if this is the pathway they want. All right. Well, thank you so much again for joining us today, Dr. Kennedy. Your insights are really helpful, not just to current applicants, but future physicians out there. And on behalf of the Texas Health Education Service and TMDSAS, we want to wish everybody all the best of luck with your application and preparation. And we'll be here when you need us. Take care.